Hi, good morning. My name is Namrata Gorpuzapun. My student ID is 220555307. I'm one of the students from Master in Nursing Practice third year. And today I'm going to give a presentation on Mrs. Mann's case study and her clinical manifestation that escalate to activate MedCall. So before I start, I want to share my screen. Let's talk about what is a medical emergency call. Medical emergency call is a situation where someone needs an immediate medical attention, which is very critical and important in healthcare sector, in hospital as well. So let's talk about case overview, where we will talk about Mrs. Mann's case study. So Mrs. Mann is 75 years old lady. She presented to emergency department at 9 o'clock from home due to decrease in GCS and breathlessness. She also had a fever for 3 days and felt drowsy for a couple of days. She had an intermittent cough, but she wasn't unsure about what is the causes of cough, as she is a regular smoker. And the medical was activated at 12:30, 22:30 at night. So the clinical manifestations to activate the MedCall is this all. So one of the clinical manifestation is respiratory rate, high respiratory rate, low SpO2, low blood pressure, high heart rate, low GCS, and high fever. And the next slide, I'll be talking about all the clinical manifestations to activate MedCall for Mrs. Mann's case study, and I'll be explain all the clinical manifestation in details. So let's talk about airway. Airway is clear and patent, and there is no any signs of obstruction currently, which is a good sign, and there is no any immediate intervention is required for airway, but there is a risk of airway obstruction in the future due to drowsiness and GCS low. And the breathing, the high respiratory rate and low SpO2 is one of the clinical manifestation to activate MedCall, because he has a high respiratory rate 28 and low SpO2 75 on Houston mark, but it was improved to 95% with BiPAP initial setting FiO2 50%. And according to ABZ result, it shows that she has respiratory acidosis and hypoxemia, which indicates that she has respiratory failure. And let's talk about circulation. She has low blood pressure, which is 90/50, which is one of the clinical manifestations to activate MedCall. And she also has a high heart rate, 118. This is also one of the many clinical manifestations to activate MedCall. Hypotension indicates that she has severe sepsis and possible circulatory shock. And then another one, high respiratory rate. She has a high respiratory rate to compensate low blood pressure and infection. Let's go to another slide. Let's talk about disability. She has a decreased GCS 13, and which is also one of the clinical manifestation to escalate MedCall. In her case, she has a low GCS, which tells that her mental status is altered. This might be due to systemic inflammation affecting to her brain, which can cause confusion, disorientation, and decreased level of GCS. Also, hypoxemia and hypercapnia can affect brain function and GCS score as well. Let's talk about exposure. She has a high fever, 39.8, which is also a common indication of sepsis. And also with one of the reason for MedCall. And also she has a right upper quadrant abdominal tenderness, which indicate that she might have an infection or inflammation in liver or gallbladder. And talking about fluid, she is not tolerating any oral fluid, so she's in nil by mouth currently, and she's passing urine 50 ml per hour only at the moment. It means she is dehydrated. Talking about glucose levels, her glucose levels is 19.8 mmol per liter, which is slightly high. And let's talk about pathophysiological link to clinical manifestations and underlying disease. She has a background history of emphysema, hypertension, ISD, and smoking history for a long years. Let's talk about emphysema. It is a chronic lung condition where the walls of alveoli break down and leads to tiny air sacs in the lungs, and it decreases the surface of the gas exchange. And due to the lower alveoli, it has a low oxygen saturation and also high carbon dioxide in her blood. So now this is one of the reasons her oxygen saturation is decreased. And she is saturating 95 in BiPAP support, which indicates that she has a severe exacerbation of chronic respiratory condition. Let's talk about hypertension. She has a history of hypertension, and which means that she has a high blood pressure, which can damage the blood vessels and damage organs such as heart, kidneys, and brain if it goes for long run. So in her case, her body's immune response to infection with inflammation, and her body releases various chemicals by like cytokines and nitric oxide to fight with the infection. So which causes increased blood flow and then widen the blood vessels, and also which ultimately lead to the low blood pressure. Let's talk about ischemic heart disease. It has a history of ischemic heart disease, which means that narrow of coronary arteries and reduced blood flow to the heart muscle. Also, she has an history of 80% RCA stenosis and previous unsuccessful PCI. So, which means that she has a significant heart disease, and her heart is already compromised for a long time. She has a low blood pressure that leads her heart to pump more blood to the heart. This is one of the reasons her heart rate is high. So talking about her smoking history for 90 pack years, smoking in long term helps to damage lungs and cardiovascular system. She already weakened her lungs, and when the lungs are weakened, there is a high possibility to get infections like pneumonia. And talking about sepsis and organ failure. Sepsis is a life-threatening condition triggered by abnormal immune response to an infection, which leads to extensive inflammation, tissue damages, and organ failure. According to primary survey format and the other laboratory findings, it is indicated that she has severe sepsis and multi-organ failure. Her laboratory findings actually shows that she has potential left lower pneumonia, and the sign and symptoms such as high fever, high WCC, and high C-reactive protein indicate that she has a severe inflammatory response. When there is infection, the inflammatory mediator causes vasodilation, which leads to hypertension and tachycardia. Hypertension decreases blood flow to the kidneys and decreases kidneys' ability to remove waste and toxins, and also it reduces the ability to balance the electrolytes and fluids. So in her case, she is passing low urine output and then increased creatinine and decreased eGFR, which means that she is likely to have acute kidney injury. Let's move to another slide. We'll talk about sepsis. Yeah, we already talked about this. Let's move to another slide. So we'll talk about pathophysiological link between underlying disease conditions and clinical manifestations. Talking about emphysema and smoking history, she is smoking for a long time and has a history of emphysema. It means that she already has a compromised lung function for years. And then she is having infections, for example, pneumonia. Due to emphysema, it reduces air entry in lungs and increases respiratory rate. And talking about ischemic heart disease, she has a history of ISD and already blockage in her right coronary stenosis, which reduce the blood flow to the heart and leading to heart disease. Also, she has a history of unsuccessful result for percutaneous coronary intervention previously, which shows that she has severity of cardiovascular disease, which is one of the reasons she is showing signs and symptoms of respiratory distress and low GCS. Also, sepsis and organ failure. It is a life-threatening condition, organ dysfunction caused by infection. So she has a high fever, which indicates that she has a severe infection. And also, she has a high WCC, which is able to fight through the infection. Also, she has a high lactate level, which reduces the supply of oxygen and reduces the supply of blood. She feels drowsiness and her GCS has decreased due to the poor perfusion in her brain. So let's talk about the management plan. So while going through all the clinical manifestation, the nurses are now responsible to make a management plan for each clinical manifestation. So one of the clinical manifestation is respiratory support. Respiratory support, as per her respiratory rate is high and low oxygen saturation. So it is important to continue her in BiPAP machine with FiO2 50% to maintain her oxygen at 95%. Also regularly checking her SpO2 level to ensure that she is saturating more than 92% is important to ensure her safety. It's also important to check her respiratory rate and lung sounds regularly to see any improvement in her breathing. It is also important to monitor ABG result closely to manage her respiratory distress. It is also important to administer bronchodilators such as short-acting agonist to relieve bronchospasm and improve her patency. And also nurses need to monitor any signs of respiratory fatigue and prepare for intubation if necessary. So another management plan is fluid resuscitation and vasopressure therapy. It is important to administer IV fluids immediately to improve her blood pressure, as she is nil by mouth at the moment. And if the hypotension continues, please administer vasopressor to increase her blood pressure. So it is also important to monitor her blood pressure and high rate regularly, and also need to monitor urine output and monitor any signs of fluid overload because if she is in IV fluid. And also supportive care, what is one of the most important management plan. As per her GCS is low and then drowsiness, it is important to put her bed in low position and use the side rails off if possible. Also perform a frequent GCS scale to monitor any changes in her responsiveness and consciousness. Also, it is also important to correct her hypoglycemia immediately to prevent any further deterioration. And another one is antibiotic therapy for pneumonia and sepsis. As per her fever is temperature is 39.8, which is the indication of infection. So to control the infection and to support organ dysfunction, it is important to start broad spectrum antibiotics immediately as per the hospital protocol. So it is important to take the blood cultures to identify any the main source of infection as well before starting any antibiotic. And also nurses need to monitor WCC, CRP, creatinine level, liver enzyme, and lactate level to assess any response to the treatment of infection. So one of the last most important management plan is effective communication and coordination with healthcare team. This is very important to ensure the Mrs. Man is safe in the hospital. So nurses need to have clear communication with the multidisciplinary healthcare team about her condition and the management plan and the response to intervention to ensure that she is safe. So managing all her high priority clinical manifestation, it ensures that she receives prompt and timely care to improve her condition and prevent further deterioration. So this is the end of the presentation. So I have included all the references here. Thank you. I hope it helps.